let's see, 8:04. I think we are going to go ahead and get started, and we'll allow the others who are on more Miami time to join us as they can. So welcome. My name is Cierra Bragan, and it is truly, I say this every time, but it is truly my joy, my honor to be your moderator and your host tonight. I am the owner and founder of Miami Mom Collective. We're Miami's premier parenting resource and community for moms. We do events, we have resources, and we work with local and national brands to promote what they're doing. So we have loved working with UHealth Jackson Children's Care on this series because it's been such a valuable resource. Personally, I have learned so much. I know our viewers, we've had amazing feedback. So we're just super thrilled to continue the series. And so tonight, we are going to jump right in talking about what does COVID mean for flu season. So we know COVID's a hot topic. We've never dealt with COVID and flu. So there's just a lot of certainly unknowns, but also a lot of things I think we can do to prepare, which I know our panelists tonight will share with us. But I want to take a minute to draw a couple things to your attention, which you may or may not know. So the pediatric emergency rooms at Holtz Children's Hospital and Jackson North are available 24 hours a day. So nobody ever wants to have to visit the ER with your children or for yourself. Actually, my brother and his wife had to visit an ER last night in another state. But man, it's a tough thing to do and to make a decision of where to go. But just so that you know, the Holtz Children's Hospital and Jackson North are available 24/7. They're also staffed with board certified pediatric emergency medicine specialists. So you get access to all the sub-care specialists, from the university health system, from Jackson Health System. And actually the Holtz Children's Hospital is a 24-hour kids only emergency room. So that's kind of nice. You don't have to, deal with everybody if you just have an issue with your kids. So also the doctors there and the nurses are certified in pediatric advanced life support. So I share that to say, heaven forbid, hopefully you never need it. But if you do, we just really recommend that you check them out because they're open 24/7 and they're going to be the best of the best for you there. So, well, without further ado, let's dive right into tonight's topic. But before we do that, I'm excited to introduce our two panelists tonight. So joining us is Dr. Barry Gelman. Dr. Gelman is a pediatrician and a pediatric critical care specialist. So he's an associate professor at the University of Miami in the Department of Pediatrics. He's also an attending physician in the pediatric intensive care unit. So if anyone's ever had to deal with the pediatric ICU, man, it's important to have very, very wise and strong leaders there. So Dr. Barry Gelman is very familiar with that part of the hospital. He's also the chief medical officer for the Holtz Women and Children's Hospital. So he serves on numerous leadership committees. He's also certified in pediatrics and pediatric critical care medicine by the American Board of Pediatrics. And this is interesting, from 2002 to 2020. So do the math, 18 years. So he probably started it when he was 10 or 12 years old, right? He directed the pediatric residency program at UM, and he trained hundreds of pediatricians. So literally tonight, it's our joy and our pleasure to hear from him. And he recently earned a master's degree in medical education. Additionally, he serves as the vice chair for education in the Department of Pediatrics. And of course, he's a fellow of the American Academy of Pediatrics. So welcome. I think your expertise is definitely in pediatrics, which we have lots of questions about. So we're glad you're here, Dr. Gelman.
Thank you, Sierra. Thank you. That was a little long, but I appreciate it very much. And it's great to be with you. Thank you for inviting me. And hello, Judith, and hello to the audience.
Yes. And Judith, we are so excited to hear more about your story. What I'm most excited about having Judith is, ladies and gentlemen, she's just a fellow Miami mom with a story to tell that I think is going to be really impactful for you. She is the mother of Victoria Bermudez, and we're going to hear more about that in just a little bit. All right. Okay. I have the first question, and I'm happy for you, Dr. Gelman. Tell us how is the flu different from the common cold? Because we're used to runny noses. How do we know the difference?
Um, Great question to start with. So the common cold is what we call an upper respiratory infection. So the symptoms of the common cold would be things in the upper respiratory tract, the nose, sniffles, sneezing, sore throat, but generally not more than that. Actually, most kids and adults who have a cold, an upper respiratory infection, don't even have a fever. So there can be most of the time no fever or a very low grade fever. And as I said, symptoms only in the upper respiratory tract. Usually a cold is gone in 2 or 3 or 4 days. If the symptoms are lingering longer than that, it's probably something else. So if we contrast with the flu, what we call the flu, which is infection with influenza, which is a different group of viruses. Viruses cause colds and upper respiratory infection. And then influenza virus, of which there are several types, cause what we call the flu. Those symptoms are more systemic. So you can have the upper part, you can have the runny nose, you can have a sore throat, but you also get more systemic symptoms. For example, a headache, muscle aches, a higher fever. You can have GI symptoms like vomiting and diarrhea with the flu. The flu also lasts longer. Typically, the flu is 5 or 6 or 7 days before you're over it. So what we tell parents is if the fever's gone on for more than 2 or 3 days, or if the symptoms are there for more 2 or 3 days, it may not be a common cold. It may be another type of infection.
Okay, yeah. So that's a good tip. Something I didn't realize, looking for the length of symptoms. Like a cold, you say usually kind of shakes itself out in 2 to 3, 4 days, but the flu obviously hangs around a little bit longer. As parents, all of us can relate to having a sick child with a fever, a runny nose, a cough, and it's just hard to see our children like that. And honestly, sometimes we can even be a little dismissive of it. We can either be kind of full on like, oh, they're so sick, or we like, oh, it's just a little cold, they'll be fine. But Judith, I want you to tell us about that day in 2014 when you took your then 6-year-old daughter Victoria to an urgent care center for what you thought was just a bad cold. Can you share your story with us?
Yes, correct. So the hardest part, I think, for us parents, our little ones cannot always express themselves. So it's trying to figure out what really hurts, because they just, they're so limited in expressing. So just like Dr. Gelman said, it had been a whole week of her not feeling well. And I was doing just what every parent has been told to do by the pediatrician, do the Motrin and the Tylenol every 6 8 hours.
Alternate.
After that weekend, when I see that she was just not getting any better, I took her to urgent care. It was the nearest urgent care to home, and they did the regular routine, the checkup and the temperature and so forth, which she did not have a temperature at the time, but they did test her, and she came back positive for influenza A and strep.
Okay. Oh, wow. Both. Ooh.
Correct. Yes. So then on top of that, the physician there at the urgent care, which was fantastic, she was listening to her lungs, and she heard that she had a little crackling on the left lung. Of course, at that time, I was totally oblivious. I'm still mom, but now I think I'm a little bit more educated. At the time, I had no idea what she was talking about. So it so happens that apparently she was building a small pneumonia on the left lung. And that's when they decided to transport her.
Oh, wow. Scary. So from the urgent care center, they decided to transport her because they realized.
Yes. She was transported to the nearest emergency room, where she was there just for 24 hours. There she became septic. I don't know if you want me to continue with the story or.
Wow. Yeah, I know we're going to get more into it. So kind of whatever you think we need for right now, and then let's get more into it. But my goodness, things just can change in an instant for sure. Wow. Okay, well, let's pause there for a second then. So you went to the urgent care, and okay, we thought we had a bad cold, but turns out flu and strep, which I didn't even know you could get the two together. It makes sense, I guess, that you can. And then you realize she's transferred because of pneumonia. So, okay, so, Dr. Gelman, tell us.
Cierra, before you give me the next question, I just wanted to emphasize 2 things that Judith just said that are really important for her story and for everybody listening.
Yes,
The
please.
first is that, so Victoria is a perfectly healthy girl, and she gets influenza. That's the first thing to keep in mind. And the strep part of it, so she had influenza and then had a bacterial infection with strep pyogenes. Strep pyogenes is actually the strep that causes a strep throat, but it was in Victoria's bloodstream. And being sick with influenza, even if you started healthy, does predispose you for other bacterial infections. So she's a healthy girl, never been seriously ill, and then gets the flu, has another infection, and then became much sicker, as Victoria's going to get to when we go on with her story.
Wow. Wow. Yeah, I had no idea that having the strep like that could put you susceptible to even more things. And then the fact that it went to her bloodstream. But yeah, good point that she was overall a healthy girl. And it's just, and it seemed like she just had a cold, which, like I said, a lot of times, even as moms, we can kind of overlook the runny nose, cold, they'll be fine. It'll shake out in a week or so, you know, but I think those, like you were saying, Dr. Gelman, being mindful of how long those symptoms are lasting, that it can get critical really quickly, which obviously we're going to hear more about. Tell us, Dr. Gelman, how does the flu present itself in children, and like what are signs we should watch for that this maybe needs prompt medical attention?
So a very high fever, let's say 103, 104 degrees, that's not consistent with and not indicative of the common cold. If it's going on for close to a week. And then other things to look for are those other signs. So for example, if a child is having difficulty breathing, if a child, their lips are blue, what we call cyanosis. If you look at their chest and there's a lot of tugging, we call those retractions. If it appears that a child is having difficulty breathing, if they are very tired and listless and don't want to get out of bed, don't seem to have energy, those are signs and symptoms where you would want to have the child evaluated by a healthcare provider to possibly test and see what could be going on. And Judith, of course, did the right thing. After Victoria had been sick for a week, she said, okay, well, she's been sick for a week, I need to take her in.
Right. Wow. Wow. I'm thinking about, as a mom, you know, having that scenario, and oftentimes it's hard to, make that decision of, do I rotate Motrin and Tylenol and care for them at home, or do I seek more serious medical attention? And I would say, Judith, in Victoria's case, what made you think that it was time to go to an urgent care center at that point?
Honestly, I think it was just a mother instinct, if that is such a thing, because she was in good spirit the whole time. Yes, that Sunday night she didn't sleep well. So I think that's what triggered it. She was coughing a little bit too much for my taste.
Right.
And Monday morning she was fine. She stayed home from school with grandma and she was playing. She didn't have too much of an appetite. But then at midday, when grandma told me, her fever spiking up a little bit, not too much, I told her, okay, fine, give her some Motrin and let's take her to urgent care just to check it out. Because like you said, as parents, our first tendency is to run to the pediatrician. And the pediatrician is like, oh, it's just a common cold. And they send you away, right? They do Tylenol, Motrin, Tylenol. It's like, okay, before I bother the pediatrician again, as a freak mom, let me just add, but
that's right.
It backfired.
Man, and you got, okay.
I would just add that there absolutely is such a thing as maternal instinct. And now speaking to all the moms and dads and caretakers out there, any good pediatrician, when a mom or a dad or someone who knows the child says, my child isn't acting right, we absolutely take that very seriously, because who knows their child better than mom or dad or grandma or whoever's taking care of them? So that absolutely is one of the most important things that you can say if you have to go to the pediatrician's office, if you have to go to the ER or urgent care, is to say, my child isn't acting right. And that will immediately get attention.
That's good. That is good. Ooh. Okay. So Judith, you take your there to urgent care, and then like you said, she's getting now you're like, we just came to everything changed in an instant. You had to have been living a nightmare. What was that like for you?
Okay, Sarah, your internet was breaking up a little bit, but I think I got the.
Did I freeze? What was that like for you?
Yeah, no worries.
Oh,
Um,
sorry.
I was a little confused. I was, it happened so fast. I was like, what is going on? Like, I just took her to, okay, she tested positive, just give her some medication and send her home, right? But no, all of a sudden she dialed 911. The doctor at urgent care, she was not waiting for their local ambulance to arrive. She dialed 911 and Metro came and picked her up and took her to the ER. And she was, like I tell you, alert, flirting with the paramedics. She was all being Victoria. And when we got there, they did an x-ray of her lung just to make sure there was what the doctor predicted, pneumonia. Sure enough, and within 10 minutes, all hell broke loose.
Wow. Okay. We're getting there. You're building the anticipation for us. I'm like, as a mom, my heart's like racing. I'm like, I want to know. Do I want to know? And maybe I don't want to know. But quick question for you, Dr. Gelman. What are the things that we can do to protect ourselves from getting the flu? And then if we do get it, what steps can we take to ensure that our family doesn't, like that we cannot infect them?
So I think everyone knows the answer to this question already, but I'll review, because the same way that COVID is transmitted, influenza is transmitted. So all of the things that we've been hearing on television, on the radio, and reading about online in terms of protecting yourself, the same things apply. We actually believe that COVID is more transmissible, more contagious than influenza, but they're transmitted the same way. They're transmitted with droplets through the air. It also can be transmitted via contact, via surfaces. So the most important things are to, if you're coughing or sneezing, to not do that near somebody else, or not be near somebody if they're coughing or sneezing. Wearing a mask, the same way a mask protects you and prevents you from infecting someone else with COVID, it would also work for influenza. Disinfecting surfaces, and very, very, very important, I can't overemphasize, hand washing, hand hygiene, making sure that after you are out and about, coming home, handling things, washing your hands very, very frequently. Those are the things that you can teach your child to do that if they're old enough. Those are the things that can protect you from both COVID and influenza.
Okay. Yep. Good. We know these things. I love that you said that, because it's like, man, in our gut, we know we just got to do them, and we've got to be diligent. And then also in teaching and training our children, especially now that some are back to school, and so they're susceptible to a whole new range of germs out there. I do want to draw your attention, those that are listening in, there's a chat feature and there's a Q&A feature. So if you have a question, we encourage you to drop it in the Q&A. We're going to get to some more kind of COVID specific things in just a little bit. But if you have questions as we're talking of anything that we're talking about, please drop that there. We'll do our very best to get to each one. So yeah, just want to make you all aware of that. Okay, Judith. So because of Victoria's illness, the severity of it, she was moved actually to Holtz Children's Hospital at the University of Miami in Jackson Health. Had you ever been to the Jackson campus before? Like, take us back to that moment. What was, going through your mind? You said things got really severe really quickly. Can you tell us more?
What? Shame on me. Shame on me, because my sister graduated from the School of Nursing when it was up back in the day, right in front of the main building now. And my brother-in-law, it's a doctor there as well in the psych unit. I never, ever visited Jackson, only to have lunch with them. And you know what? I did what I don't know. I just did what everybody else was doing. I took it to the nearest facility. Needless to say, now I live at Jackson. I love Jackson. Why? Because, in my opinion, I might be wrong, but from what I've seen and I have learned, they have everything that you need, that your child or your family member needs in case of a true emergency. So when we arrived to Jackson, she was sick. By that time, she was a broken puzzle. She was all over the place. I remember walking into PICU, and the front desk was just filled with doctors and nurses waiting for her arrival.
Oh,
That's
wow. Oh, that's scary.
yes. And then they took me to the waiting area and they took her with them. And then the first team that took over right away was the infectious disease, because now she became septic. She had 3 cardiac arrests and 2 respiratory arrests.
6 years old, right? She was 6 years old.
Yes, within a 3-hour period. So she was very sick. They took over. There was other complications. She had an ischemic foot from the sepsis. But you know what? The way that the team took over was just, it was priceless. I was in awe. I was amazed. Like, the doctors were talking to me and I couldn't, I was like, what are you talking about? We just,
What's happening? Yeah.
you know, it was just a flu. We get the flu and we move on, right? We take care of it with and tea. Not in her case.
Wow. And Dr. Gelman, I know that you were one of the lead physicians on Victoria's medical team. Like, can you talk to us about that moment? Like, how critically ill was she in this moment? And you're meeting them here at Jackson.
Sure. It's probably hard in some ways for Judith to think about it, and it's hard for me too, and it may be hard to hear, but I can tell you next year, 2021, is going to be 30 years for me practicing critical care medicine, and she was one of the sickest patients that I've ever seen. She had, so firstly, let me say, and I've said this before many times, I want to give credit to the referring hospital that she went to first, that ER, because they recognized that that she needed to get to a higher level of care, that they would be unable to care for her. So they sent her to us very quickly, which absolutely saved her life. But she had cardiovascular collapse. So she had shock from the overwhelming infection. And what Judith just talked about, the cardiac arrest and the respiratory arrest, those are not like a heart attack like an older person would have. Those are collapse. What happened to Victoria was collapse of her circulatory system. So the heart and the blood vessels that move blood all around the body, including to the lungs, just stopped. And that was from the overwhelming combination of influenza and the strep pyogenes, the bacteria that was in her blood. And she needed something called ECMO, which is extracorporeal membrane oxygenation. And that's a fancy medical term for a machine that takes the place of the circulatory system. It actually moves blood around the body with a roller pump, and it also adds oxygen to the blood when the lungs can't do that, and takes carbon dioxide out of the lungs. And she needed that level of support for 16 days until her body and her lungs healed enough for her to be separated from that support. And then she had many more weeks after that of healing and recovery.
Wow. Judith, you're a strong mama. I gotta say that. I can't even imagine walking into that with my
Hi, Sierra, froze on us. Okay. Hold on.
26-year-old. It's just no mother ever wants incredible care that you received, and now the relationship. And wow, and as a biggest that you've ever seen, have you treated other healthy children with such severe complications from the flu? Is this common?
It is not common. I have treated other patients with complications from influenza. So it's important to point out that most kids and adults recover very well from influenza. Those of you listening in who've had the flu, it's nasty, you feel horrible. But if you're healthy, you recover. If you have underlying conditions, this would go for a child or an adult, things like asthma or emphysema or diabetes or kidney disease or heart disease, then you're at a higher risk from influenza. But again, I want to come back to the fact that Victoria was a healthy girl. In the 2019-2020 flu season, so that was the last flu season. We're now in the 2020-2021 season. It's just starting. In the last flu season, 194 children died in the United States from influenza, and about half of those had no underlying conditions when the CDC and the local health departments look at the records. I know we're going to talk about vaccine, and you asked me a little bit earlier, what can we do to reduce the risk? I'm going to keep coming back to that. There is an effective vaccine for influenza that everybody 6 months of age and older should get. So let me stop there, and I'm sure we're going to come back to that.
Yes, we are, because we're getting questions about it. People have questions, so we're going to get to them. So thank you, those that are asking questions. Thank you for your patience. We're going to get there. I want to camp a little bit more on Victoria's story. So Judith, Victoria was in the intensive care unit at Holtz Children's Hospital for almost 2 months. Is that correct?
Yes, 88 days exact, because that included the rehab.
Wow.
The Gelman had a lot to do with, well, everything to do with it, in my opinion.
Oh my goodness. And so I know during that time, you probably barely got to go home and see you had another young daughter who was at home with your husband. What do you remember most about that experience?
About leaving Olivia?
Yeah, and having to be all those days with her, because I'm sure you didn't want to leave Victoria's side.
Out of the whole ordeal, I think that was one of the hardest things, because as Victoria was being treated at the first facility, they went ahead, the physician that was treating her in the ER went ahead and called grandma, which was taking care of Olivia, and asked her to come over. And Olivia was tested in the ER, and she tested positive for the flu also, and grandma tested positive for the flu as well. So grandma was treated right there and then and released. Olivia, they decided to keep over, and they kept her for 6 days. They started her in the Tamiflu and fluids and so forth.
Wow.
Ambulance comes to pick up Victoria, and I realized, it hit me, right? Because I was so focused on being next to Victoria. She was very ill. And I realized, oh my Jesus, I'm leaving Olivia behind. I wanted to get off the ambulance and run and cry. I didn't know what to do at that time. But little did I know that I had the best support team behind me. All my co-workers at work, home, my husband and grandma moved over. Grandma just picked up her things and she moved in. And they just took over the whole thing. It was a fantastic, I couldn't ask or plan for a better support system. My co-workers will pick up Olivia, take her to school with them, bring her back home. So grandma didn't have to put more stress on herself. It was just priceless. But she recovered well from the flu.
Wow. The thought didn't even cross my mind that you're at the hospital with one child who is diagnosed with the flu. You have another child at home. I'm not even thinking, oh, that child could have the flu too. And you're having to then leave her home. And wow. I know I keep saying wow, but I just think as moms, you know, we can relate to this on an emotional level, even if it's not our child, and it's just, it strikes you, and it does, it puts kind of this heaviness under you. Would say, like, we have such a responsibility as the best care for our children, and you know, that led you to, wow, okay, I know that she had a lot of recovery. There was so much trauma. She was bedridden for so long. Talk to us about the rehab care that she received. I mean, she had to learn to walk, talk, feed, everything, right?
Yes. So I remember clearly, like if it was yesterday. Actually, Dr. Gelman is the one that pulled me aside, and he explained about it, removing the tube and placing the trach. Of course, I'm mom, I'm oblivious, I don't know what's going on. He took his precious time and he explained to me the whole procedure and the benefits behind it. So he told me the minute she has the trach, we can start waking her up, and she can, the sooner she starts her rehab, the better it is. And sure enough, there in PICU, they started with the physical therapy. They started getting her out of bed. She was very, very sick and very weak. They started getting her out of bed. They started moving her and so forth. So then came the day where she needed more intensive therapy, right? She was ready to not so much be discharged, but she needed more therapy. And correct me if I'm wrong, Dr. Gelman, but it was under my impression that they wanted to send her to an outside rehab center. And Dr. Gelman was like, oh, no, that's not happening. She's very fragile. She's one of our sickest babies here. I cannot let her go. So I don't know what he did, what his magic was, or his secret.
Magic. Kept her close. I love it.
Opened up the unit for peds in the rehab center, and Victoria was the only child in the unit. And they started her physical therapy right away, like the next morning. It was very hard for me as a mom. I think it really was. It was 15 days that we were in rehab, but to see her in so much pain. Before she was just laying there and the doctors were doing everything to her. Now she has to do the work, and the pain that she was going through, I think that was one of the first times that I wanted to cry. I didn't cry. I never cried, but I wanted to.
I don't know how.
I saw her going through so much pain, but she did her therapy and she did it well, and she graduated, and then Dr. Gelman took her back again into PICU because he didn't want to let go of her until he had to discharge her.
You had some seriously good care. I will say that. It's clear. And
she also needed
can you say that bit again? It froze up.
No.
What?
When she went home, she continued with outside therapy twice a week.
Okay. How long did she do the outside therapy?
It was a while because she went home with the trach and the foot, it was still healing. I would say like 2.5, 3 months of outside therapy until school started. So she was released May and school started in August, and the doctors gave her the okay to go back to school, and she did.
Wow. What an incredible recovery. Tell us good news. How is Victoria doing now after all that? I mean, she was 6 years old. How old is she now? Tell us how she's doing.
She's 12, and I'm giving her up for adoption because she's crazy. So
she put you through a lot in 6 years, in her 12 years, I guess.
College paid for and everything. You can take her.
Yeah.
She's a handful. She's doing good. She really is. All joking aside, cardiology gave her the clearance. She is being followed closely by the pulmonologist because they were damaged to the lungs. I guess Dr. Gelman could explain better than me, but as a mom, this is how I know how to explain it. Her lungs were damaged. So the pulmonologist follows her and the immunologist follows her. We've had a little bit of a hard time boosting up her immune system, but she's doing fantastic. And she doesn't hold back. She swims, she plays volleyball, she participates in everything.
Incredible. Okay, I have to ask, Judith, prior to Victoria's illness, did your family, we talked about vaccines, did your family get annual flu vaccines?
That year we did not.
Okay.
We did not.
How did her crisis, did it change your perspective on getting the flu shot?
Yes, absolutely. Yes. And as a matter of fact, I'll tell you that after we came home, it was maybe 2017. Victoria gets the shot because she got it at the immunologist's office. We were there for a follow-up. He had it, so he gave it to her. Okay. Olivia and I come home and we did not get the flu shot, not yet, because her pediatrician had not gotten it. And where I get it at the pharmacy, they didn't have it. So guess what? Olivia and I got the worst flu that we've ever experienced. And Victoria was like nothing. She was our nurse.
Wow. After all that she had been through. Man.
I had to take off the longest, over 5 days from work, because my body was just in agony pain. Yeah. And it didn't affect Victoria at all. And she had the flu shot already.
Dr. Gelman.
Yeah, I was just going to add, the listeners may be wondering, why did Victoria need a flu shot after she recovered from influenza? Shouldn't she be immune? And the answer is no. We have to get a new flu shot every season because the types of influenza that are circulating change from year to year. So what the manufacturers of the vaccine do is they, as carefully as they can, they look at the serotypes, the types of influenza that have been circulating, and then they try to create a vaccine against those types. So it changes from season to season and from year to year, which is why we have to be vaccinated every year going into flu season.
Okay, that makes sense. Yeah, it's not something where you just get it once, chicken pox, and you're done.
Correct.
You need that every year. A question, Dr. Gelman. I have a almost 2-year-old and an almost 4-year-old. How old do children need to be to receive their first flu shot?
6 months or older. Anyone who is 6 months or older should be vaccinated.
Okay.
Unless there's a contraindication, and the list of reasons to not be vaccinated are very few. If you are younger than 6 months, then you cannot get the flu shot. If you've had a severe reaction to a vaccine in the past, you cannot get a flu shot. But other than that, everyone 6 months and older should get a yearly shot.
Okay, so those are really kind of the scenarios where a child shouldn't get it. There's not really a huge long list of scenarios.
That's right.
Okay.
And if a child has underlying health conditions that would put him or her at risk, like asthma, for instance, or being an ex-premature baby that has what we call chronic lung disease of infancy, where the lungs are healing from being so premature, or an immunodeficiency, a child who is recovering from leukemia and has received chemotherapy. It's even more important because in those settings, there can be more morbidity, more serious effects from getting infected with the flu. So it's even more important if you have an underlying condition. But even if you're healthy, as Victoria's story teaches us, even if you're healthy, you still can get very sick. Remember, I said last year, 194 children died from influenza. So it's really, really important to get vaccinated.
Yeah, that's good. We have some moms who are asking, since we're quarantined, we're using masks, do we still really need the vaccine? I mean, I hear you saying the only reasons you wouldn't is if you're under 6 months and these other scenarios, and are there any cons to receiving the vaccine?
Okay, we lost you towards the end there. I think your question was, if we're wearing a mask, do we still have to get, if we're wearing a mask and we're quarantined, should we still get the vaccine? The answer is yes, because there are different types of protection. Wearing the mask is one type of protection, washing your hands is one type of protection, but getting vaccinated means that you are getting inactivated virus in your body, and your body is building up immunity against influenza, and you can't get that from a mask, and you can't get that from washing your hands, and you can't get that from social distancing. You are making your body more resistant to getting infected in the first place. And actually there's data that you still can get the flu if you get the shot. And the reason for that is that, remember I said that the shot covers some of the types that have been circulating. If you happen to get infected with a type that was not in the vaccine, you can still get sick. But the data shows that if you do get the flu after having been vaccinated, your symptoms are much milder and you get better faster. So absolutely yes, mask is important, washing hands is important, distancing is important, but the flu vaccine is very important.
Okay. Are there any cons? Kind of the second part to that question is the mom wonders, are there any cons to getting the vaccine?
Not really. The most common side effects are things like a little bit of pain at the site, a little bit of redness at the site when you get the shot. You can get a low-grade fever afterwards. And actually, if you're new to the vaccine, you're more likely to get some of those mild side effects. Whereas if you've been taking it year after year, I mean, I've taken it every year and had no side effect after I take the shot at all. So there really is not a downside. It is a safe vaccine. The way it's manufactured is the same way for many, many years. And why would you not want to protect yourself and protect your child, especially going into a season now? And this is what you led with, Cierra, was we're going into sort of an unknown. We've got COVID and we've got influenza, and what's going to happen in a season when both of those can make us sick. Well, we don't know, but
Right.
since we don't know and it could be dangerous, why would we not want to protect ourselves against the one that has an effective vaccine?
Right. Let's be prepared to do what we know to do with one of them. So not have to deal with that. I have one mom who's asking, her daughter is healthy, but she developed hives the morning after her flu vaccine a couple years ago. Is it safe for her to get the vaccine again?
Yeah.
I don't know.
I think I heard the question. So it's a child who a couple of years ago got the flu vaccine and had hives.
Right.
So you definitely should check with your doctor. The answer generally is yes. She should be able to receive the vaccine. What is sometimes recommended is if it was a severe allergic reaction, and hives is an allergic reaction, but there are more severe ones, like when you have tightening in your chest and difficulty breathing and needing epinephrine. So generally, just with hives, we would administer the vaccine without a problem. Sometimes the recommendation is to give the shot and then monitor that person for a certain amount of time, that child or that adult for a certain amount of time. So definitely check with your doctor. But the fact that that your daughter had hives a few years ago does not mean that she shouldn't get the shot. In fact, I believe she could get it and it's safe.
Okay, great answer. Thank you. I'm a pregnant mama, and there's another pregnant mama who's also in her third trimester. We're here at the end. How vital is it for us to get a flu vaccine while pregnant?
Very important. It is safe when you are pregnant. And in addition to protecting you, your body makes antibodies against influenza, and then you can give those antibodies to your baby, because remember, babies younger than 6 months cannot be vaccinated. They don't have enough of an immune response. So what you would be doing is giving what we call passive immunity. There are two different types of immunities in medicine. There's active immunity. So when you get a vaccine, your body makes antibody against whatever that antigen is, in this case, influenza. That's called active immunity. Passive immunity is when you give somebody antibody, like, for example, the monoclonal antibody therapy that the president got for COVID. That's passive immunity. So by getting the shot, you're getting active immunity for yourself, but you're actually going to pass passive immunity. You're going to pass antibody against influenza to your baby, which can protect your baby in the first few months of life.
Oh, wow. Yeah, that's huge, especially if my baby's due in 2-3 weeks. So I'm like coming here in the middle of flu season. So, wow, I have to say, I haven't gotten it yet. So I got to go to do that. So thank you. Also, okay, one mom asked the question, what can we do to prevent the flu from getting worse? I think you touched on this, but of course, masks, washing our hands, disinfecting, and the flu vaccine. Is there anything you would add that?
Staying away from people who are sick as best you can, and not letting people sneeze on you, cough on you, hand washing. The mask will absolutely help, but most important is the vaccine.
That's good. That's good. You talked about the different strands and how each year they're kind of changing. Talk to us about flu season, because I'm thinking, okay, if I got a flu shot in February, is that enough to protect me through this season? Like, talk to us about the seasonal bit.
Yeah,
flu.
So the answer is no. If you got a flu shot in February, that was for the last season. So that was the 2019-2020 season. That's a different vaccine than the one that we're giving now. The vaccine that we're giving now, it was just manufactured over the last couple of months to try to match what's circulating in our part of the world, really, not just our community. It's recommended ideally to be vaccinated by the end of October, which is where we are now. So if you've been thinking about it, now is absolutely the best time. If as we head into flu season, any time is better than not getting it at all. But the sooner the better. It takes about 2 weeks for your body to make those antibodies so that you have immunity. So absolutely, the sooner the better. It's available. You can call your doctor's office. You can go to a lot of drugstores, and now pharmacists in the state of Florida can administer vaccines. There are a lot of ways you can get it. It's just important to get it as soon as possible because we are in flu season. October, November, December, all the way through the early spring.
Oh, wow. It's a long season. And interesting that you said it takes a couple of weeks for those antibodies. I'm looking at the calendar here. I'm like, I'm going to go get mine tomorrow. So parents out there, if you need a Halloween activity, go trick or treat at the pharmacy, take the kids. I want to ask you, Dr. Gelman, we're going to kind of transition a little bit now to a few questions about COVID and flu. Does the flu shot in any way protect us from COVID? I think I know the answer, but I want to hear from you.
The answer is no. We do not yet have a vaccine for COVID. Everybody who watches the news knows that they are being trialed. We hope to have one or more vaccines soon, but right now we do not have one. And the influenza vaccine will not protect against COVID, but it will protect against influenza.
Gotcha. And not the common cold, because that's another little just virus, right? Like has nothing
there
to
are,
do with
there's no vaccine for the common cold because there are dozens and dozens of viruses that cause the common cold.
Yeah. One mom is asking, is a runny nose and congestion now part of the list of symptoms for COVID? She said her daughter days before returning to school, so maybe that's their school's policy, but is runny nose and congestion associated with COVID?
Yes, they're part of it, but the first question I would ask if there's any fever, because most kids who are sick with COVID, most adults who are sick with COVID get a fever. So if she doesn't have a fever and feels well and just has a runny nose and maybe some sneezing, that's much more likely to be a run-of-the-mill cold than COVID. But definitely watch out for fever. The one thing I didn't talk about before, I think we started out and you asked me about symptoms of cold versus flu versus COVID. One unique thing about COVID is the loss of sense of taste or sense of smell. That does not occur with influenza. Now, obviously, if your child is very young, you won't have a sense for that. But in an older child or an adult, that's something that seems to be unique to COVID. That does not happen with influenza. That does not happen with regular colds.
Right. Okay, that's good. And I heard you just in conversation even right now saying, oh, in kids and adults that are affected with COVID, one of the questions that we received is it true that kids don't get affected with COVID? But they do, correct? Like
it is not true that kids don't get affected. That's a double negative. So kids absolutely can catch COVID and get infected. The good news is so far that the overwhelming majority of children who get infected are either asymptomatic, they have no symptoms at all, and you just caught it because somebody wanted their child to be tested, or the symptoms are very, very mild. However, it is possible for a child, we're back to Victoria's story. So healthy girl gets influenza, gets very sick. It is possible for a child to become very ill from COVID. It's just thankfully so far been very rare. The things to look for are things I talked about before. Fever, some of the upper respiratory stuff, but then other respiratory symptoms, bad cough, difficulty breathing, cyanosis like blueness of the lips, not eating or drinking well. Those are more serious symptoms. Either could be influenza or another virus or COVID. But most kids, yes, kids get infected, but most of them have not been getting very sick, thankfully.
Yeah. Wow. And for those of you who are listening who have even more specific questions about COVID and children, I will just make a plug to say we did an episode early on, actually this past summer, was a pediatrician from Jackson, specifically MISC, they're real severe, or you can go back and watch that webinar. It's a great subject. I'm watching our times. We got about 5 minutes left. If you have a question, drop that in the Q&A box. But do we know how the flu is going to interact with COVID?
The short answer is no. I'd like to think that we're going to be a little bit better off in South Florida because it doesn't get very cold here. I think that people who live in a cold environment where they have to be indoors more and are not able to be outside, I think the flu season in places like that are likely to be worse. But we don't know about the interaction. That takes me back why it's so important for each of us to protect ourselves and for us to protect our children with the vaccine, because we're going to have two diseases, two seasons interacting. And again, why not protect against one if we have an effective vaccine, which we do. So I really encourage everybody to get their children vaccinated.
Yeah, that's good. I have a question, especially during this COVID season. A lot of parents are foregoing a visit to a healthcare facility because they're fearful that their family could contract COVID. Obviously, in light of Judith's story, you think, man, I want to do anything I can do to protect my child. How would you respond to fears that parents may have about, well, let's just see how this thing plays out. Let's not go expose ourselves to potentially something else,
Right. So I would definitely check with your pediatrician or family physician or healthcare provider because they can give guidance and they can reassure you that the environment is safe. The reason it's important to check is that there are a lot of things that we're doing to keep patients and families safe in offices and in outpatient settings. For example, if it's a well child checkup, you may not be given an appointment at a time when there are going to be sick kids coming into the office. Often you go to a waiting room, and even though we try to separate sick children and healthy children in a waiting room, that would be too risky now. So actually what offices are doing is staggering the times and having children for sick visits at different times or even different days than well children. I want to reassure everybody, certainly at UHealth Jackson, and I'm sure in other practices and other healthcare facilities, there a lot of work is going into making the environment safe. I won't go into a lot of the detail because I couldn't even explain it all. I received, along with a group of physician leaders at UHealth Jackson, just before I got home, was from 5:30 to 6:30. We saw a presentation by an engineer and how they basically redesigned one of our buildings so that we can have children come in and be tested. And he was showing us how the airflow was changed, and there's an ultraviolet light, and there are filters. So the point is that healthcare organizations understand, and we want the environment to be safe, and the environment is safe. So you should call, make an appointment, reach out to your healthcare providers, but please do not delay care. If your child is sick and needs to be seen, do not get behind in vaccines. If we look at data nationally, we see that many children across the country are behind in their vaccines, not just influenza, measles, mumps, and rubella, and pertussis, and all sorts of vaccines. So don't be afraid to make an appointment and go to the doctor. It's very, very important. And a lot of work is going on to keep the environment safe, both for us and healthcare workers, but certainly for patients and families.
That's good. Judith is like, yes.
No,
I see you shaking your head.
quick, I had to take her to the ER back in May, and I was freaking out. A little something that happened to her, nothing to do with the flu, but I was freaking out. And you know what? Her immunologist said, it's safe, it's good. And it is. I witnessed it. So you're hearing it from the horse's mouth. It is safe to go to the ER, wear your mask, but do it.
That's good. We don't want to get through this whole thing and have a whole nother set of issues because we got behind on those routine visits and vaccinations and all that. Okay, one last question from our audience, but this person is asking, should we be concerned about viruses, even more once we're kind of getting back to normal because we've been in our homes and away from people? Our kids haven't been eating dirt, playing
You
outside necessarily. Should we be more concerned? Are we more susceptible to just
that's a great
everyday kind of little viruses having
that's
out?
No, that's a great question. So the immune system is not really like working out, whereas if you don't work out for a long time, things kind of turn to flab and get weak. The immune system's not like that. So if your child is healthy, even though that they haven't been exposed a lot, it's not dangerous for them to go back into the environment. But we have to be smart about it. So the same things we talked about, mitigation, hand washing and a mask if your child will wear the mask, and being fully vaccinated and staying away from sick people as best you can. But no, the immune system does not kind of go dormant when you're in quarantine. It's there working all the time, and it would function perfectly well as soon as a child goes out and is exposed to getting colds and all sorts of other germs.
Good. Great. Good news. Well, Dr. Gelman, there is no doubt that Victoria's miraculous recovery can be attributed to the expert care that you and others, at the Holtz Children's team gave her during those 3 months that she was there. What advice, closing out, can you give parents about the flu and other viruses, especially as we all deal with COVID-19?
Great. So thank you again for having me. And I have to say, it's an honor to be on with Judith and to talk about Victoria. But there were many doctors and there were many nurses and many respiratory therapists. And that's the wonderful part of working in a place like UHealth Jackson, is that we have so many great team members to provide comprehensive care for a patient when they're very sick. I would summarize this way: get smart, get protected, get help. So get smart. I think all the listeners already are smart. You guys know how to protect yourselves and protect your children. You know mitigation, you know social distancing, you know mask, you know hand washing, you know all those. Just stay on top of it. Get protected, get vaccinated for both influenza and whatever other vaccines your child needs, because there's nothing that can replace that active immunity. I talked about getting a vaccine and having the body build up resistance against those germs. And get help is, if your child is sick, if you need to go for a visit, your child needs to be seen, you're worried, don't be nervous about that. As we just said, get help, call for an appointment. Go to urgent care. Go to the ER if you must. Start with your pediatrician, or the person who knows your child the best, of what we call the medical home. Get help if you need help.
Yeah, that's great. Thank you. That's a good charge for all of us. And Judith, thank you for being with us. Mom to mom, I think all the parents and caretakers out there who are listening tonight are like, you lived it. You lived something that none of us ever hope we have to, but thank you for being an advocate as a result. And so sweet Victoria's life is surely something special. She's got some special things to do. So we're thankful for her full recovery. Thank you for sharing with us tonight.
Nice seeing you.
Wow. I hope that everyone enjoyed our time. Thank you for everybody's patience with some of our internet connectivity issues. I want to show you a few resources here on the screen. So some great resources of where you can find more information about some of the topics that we covered is in 2 weeks. So Thursday, November 12th. And our topic is preconception care. So preparing for pregnancy. I have a fun, you won't guess, so I'll tell you, but the most common months for conception, which is November to June. But we're gonna be talking about this at our next, you're planning to become parents, whether the first time or the 5th time, there's always things to learn. So make plans to join us Thursday, November 12th. We'll be talking about preconception care and preparing for pregnancy. So you can register for those at jacksonevents.org. Again, you can watch all of our previous webinars at jacksonevents.org. And again, hopefully you never find yourself in a situation like Judith did, but if you do, the Holtz Children's Hospital 24/7 ER available for you, as well as urgent care centers all across the county. So there's definitely one near your home. So check that out. Just thank you again, Dr. Gelman and Judith, and we hope everyone has a wonderful night. Thank you for joining.